Now, bipolar disorder is a bit different. Like I said, I don't spend a lot of time trying to distinguish between depression and anxiety, but I always try to distinguish between regular depression and bipolar disorder. Because if you treat somebody with bipolar disorder with the SSRIs, SNRIs, Wellbutrin, you can often make the manic symptoms of bipolar disorder worse. And I've done this before, and it isn't pretty. So if you have ever had a true manic episode in your life, then you're going to get the diagnosis of bipolar disorder rather than depression. That's not always easy to do, to determine if somebody has had a manic episode in their life. So what are manic symptoms and what's a manic episode? We use something called the mood disorder questionnaire, and it asks, has there ever been a period of time in your life when you were not your usual self and you had any of these symptoms? The symptoms are felt so good or hyper that you got into trouble, you were irritable, more self-confident than usual or grandiose thoughts, got less sleep and didn't miss it, spoke too fast, you had racing thoughts, were easily distracted, had more energy than usual, were more active than usual, you were more social or outgoing than usual, you were more interested in sex, you participated in excessive or foolish behavior, spent money that got you into trouble. If you have enough of these, that you're going to be diagnosed with mania, with a manic episode, and will be diagnosed with bipolar disorder. These symptoms are not always as straightforward as the depression symptoms. All of us have had episodes of time where we did some of these, and so I think that the mood disorder questionnaire may just by itself overdiagnose bipolar disorder. So I like to get a little bit more details about the times that they had some of these things happening to see if it really goes into a true mania. So the big distinction in bipolar disorder is distinguishing between bipolar 2 and bipolar 1. Now, bipolar 2, you are getting hypomania. Those manic symptoms are not as severe. And sometimes because they're not severe, these are difficult to diagnose. They're more likely to come in when they're just depressed. We try antidepressants, they don't work, or they trigger mania symptoms, like I said. Bipolar 1, they are easier to diagnose. They are the classic manic symptoms. Robin Williams in the old Mork and Mindy days, that's what I think of when I think of these manic symptoms. So bipolar 2, that is somebody who goes down to get their car serviced and they drive home in a Maserati that they can't afford because they splurged and bought something on a whim. Bipolar 1, these are the guys that are directing traffic in their underwear on Main Street. I joke about this, but manic symptoms and mania, bipolar disorder, is not funny to these people. I've seen people absolutely lose their lives. They get on a manic binge, they go and spend all their money, they cheat on their wives, they do drugs, they go in and tell their boss off and lose their job. They can absolutely ruin their lives in a matter of days when they go through one of these manic episodes. So medications for bipolar disorder, they're different than with depression and anxiety. The medication that's been around the longest for bipolar disorder is lithium. We don't use it very much because it has a lot of side effects. And so most of the medications we use for bipolar disorder, they're mood stabilizers that are in their seizure medications. Depakote or valproic acid, Lamictal, which is also called lamotrigine, Tegretol or carbamazepine. We will sometimes we'll also use antipsychotic medications for people who are going through a bad manic episode. Technically, they're not mood stabilizers, but they can help people to sleep and help kind of get down from some of those manic, particularly if they're having psychotic features where they're hallucinating or paranoid with their manic symptoms. And so those medications that you might have heard of are Seroquel, Zyprexa, and Abilify.